Going to be recording. We have just started the recording, so thank you. Okay, so I'm going to get started for the sake of time, but hi everyone, thank you for joining. My name is Lupa Cervantes. I am the Grants Program Coordinator here at U of M Health, Community Health Services. Today joining me is Karen.
Hi, I'm Karen Zinder, Director of Community Benefit Community Health Needs Assessment. Good to see you all.
And then my colleague also David.
Hey, good morning, everyone. David Ruprecht. I am the Community Benefit Program Coordinator.
Yeah. So we're all thankful that you are all here. As said before, for those who missed it, this will be a recorded session and it will be posted within a week on our website. I dropped the link to our website in the chat. It's bit.ly/CHPI rocks. CHPI just stands for our name, which is Community Health Planning and Investment Team. So that's where our name came from. And like I said, if you have any questions, please feel free to write them in the chat. I do ask that we will be answering questions at the very end. So feel free to write them down on a notepad or just put them in the chat. If you do have to leave earlier, that's okay. We're still going to get to the questions at the very end. And like I said, it will be recorded for your leisure to watch, for your convenience. So without further ado, thank you all for coming. This is the 2025 Open Request for Proposals informational session. Okay, so for today's agenda, we're just going to do a brief overview of our grants program history, and then we will go into the logistics of the RFP. We will be going over the eligibility, the requirements. I will also be going over the InfoReady platform and what that looks like. And then at the end, we'll have time for some questions and answers. So a little bit about how our program came about. So first things first is to just level set us all. So we do a community health needs assessment and implementation strategy every 3 years. It's a federal mandate. So what is a CHNA? A CHNA is a community health needs assessment, and it really just identifies health status, needs, and issues to inform where and how resources should be allocated. And so that's the first part. The second part is the implementation strategy. And essentially what that is based on the results of the CHNA, it outlines steps and actions that the organization plans to address as a result of the CHNA. So what it is designed to do, it's designed to make communities healthier. It involves comprehensive data collection and analysis. And like I said, it's a federal mandate, so it's a requirement of the Affordable Care Act of 2010. So this year, our priority areas are mental health and substance use disorders, access to services, which include health, medical, and social, and housing, which is safe, affordable, and quality. So our program, sorry, oops, I went ahead a little too far. So our program sought community projects focused on community health to fulfill these CHNA priority areas. And since 2017, we have awarded more than $17 million through 41 funded projects, all within the greater Washtenaw County area. And we are invested in this community and want to continue that forward. So what does this program do? So it allows for innovative solutions towards health-driven by community members, because we really believe that community members should be at the forefront and driving these initiatives because they know what they need and they know their communities best. So this is a quote from one of our grantees, Julie Payne, who is the behavioral health manager, and they are from Hope Clinic. And so Hope Clinic was one of our grantees that received an evidence-informed, well, first they had a pilot, which is a smaller grant, and then they also had an evidence-informed. And this is one of their quotes. It says, thanks to the CHS grant, Hope Clinic has been able to put systems in place to make a big impact in the lives of uninsured people suffering with mental illness who would not otherwise have access to mental health services. So their grant surrounded comprehensive mental health services and really integrating that in all of their healthcare system at Hope Clinic, in their dental clinic, in their food pantry, so all throughout Hope Clinic, is that anyone can receive mental health services at the time of crisis. So now I will be getting into the request for proposals and the eligibility and just a quick review of what that looks like. So our funding for this year involves pilot projects. So there's only one opportunity or one section that you can apply for, and that is a pilot project. And this is for innovative ideas to improve community health and social and environmentals of health, which influence one or three or more of our CHNA health priority areas. Again, those priority areas are mental health, including substance use disorder, access to services, and housing. And now the funding is up to $75,000 for a 12-month period. So this is the one that is open for this cycle. Now, who is eligible? Greater Washtenaw community-based 501c3 or nonprofit organizations are eligible to apply. Those who also have an office to serve Washtenaw County residents are also eligible to apply. And we also have a stipulation that you cannot be currently funded by us, and or funding will be ending prior to January 1st, 2026 in order to be eligible for this funding. Now, what are the intervention requirements? So it must benefit communities in Greater Washtenaw County. It must influence one or more of our health priority areas, again, mental health, substance use disorders, access to services, and housing. And it also must target community health and social and environmental factors of health, which I'll be getting into in the next slide. So what are social and environmental factors of health? Factors of health are the conditions in the environments where people are born, live, learn, work, play, worship, and age that affect a wide range of health, functioning, and quality of life, outcome, and risk. So here's a little diagram here, and we can talk a little bit more about examples in the next slide. So some examples include transportation, racism and discrimination, violence, education, income or poverty, access to physical activities, polluted air and water, language, and literacy skills. Again, this is not an exhaustive list, but anything that falls into the category of education, healthcare and quality, the neighborhood, social and community context, and economic stability will fall under the category of social and environmental factors of health. Now, what should your intervention include? It should include efforts that are responsive to community needs. It should also include an evaluation plan that captures the impact of your intervention, and it should also promote capacity building of your organization to sustain programming beyond the grant period. So we'll get into a little more about evaluation in the next couple slides. So how should you engage communities? So you should be thinking of the following questions, such as, are community members and constituents engaged in the identification of needs and planning? Are community members engaged in the local setting? And are they engaged in the evaluation of success? So what do we mean by an evaluation plan and a sustainability plan? So we would like for the purpose of the evaluation to be clearly stated. Metrics should also correspond with your goals and objectives think of SMART metrics, and SMART stands for specific, measurable, achievable, relevant, and time bound. And metrics can also be qualitative and or quantitative, and metrics need to be both process and impact in nature. And you must also create a plan for funding beyond the grant period. Now, sometimes when you want to involve community in the evaluation process and you don't necessarily have SMART metrics for that yet, that is okay. We just want those things written into the proposal of what is your plan for metrics? How do you plan? If you plan to engage community, in which way? You should start thinking of some general metrics that you plan on evaluating for. Okay, so now I'm going to go over the InfoReady platform. Okay, so I'm going to stop the share so I'm going to share the InfoReady platform with you all. But InfoReady is essentially the platform where all materials must be uploaded to. Please do not email us with your application. Everything needs to be submitted on this website here. Stop the share. I'm going to pull up the InfoReady website so I can share that with you all. So this is what the website looks like. You are going to be logging in here. If you've applied with us in the past, you may already have an account. So feel free to use that email address and password. If for whatever reason you forgot it or you need to create a new one, you would click register right here. And so when you go on our website, the link is shared on our website, and it's also shared in an email that I sent. But if you need the link, we can also send that to you as well. But the first step is to create an account, which is here, which will be login for other users with your email and password. You will click register here, fill out the necessary information, and then you should be all set to go. I'm going to pull up our specific opportunity on here so that you can see what it looks like. Just one. And as always, if you have any questions, please feel free to drop them in the chat. So this is our opportunity right here. Our deadline is December 8th at 5 p.m. All of the necessary documents are uploaded here. So what you'll do is you will download these individually. This is our full application. You will have to submit and fill out an application cover sheet as well as the budget template. The conflict of interest guidelines and reviewer bars are really just there for your discretion and for your reading pleasure. But these three documents here at the top are the ones that you want to focus on the most because it has the instructions for our RFP, and these are materials, like I said, that you will have to upload. So the way InfoReady works is you will upload these materials at your leisure. You can upload them at once. So it does save your information, but as far as the uploads, you have to have them all completed and then upload them all at once. So I suggest, you fill out your general information, and then you have all of your RFP, your application cover sheet, and your budget template completed before you go ahead and upload them so you can do it all at once. The description for our funding, again, once is here. So you will see that. Here we have our timeline. So today we're doing our informational session. It's due at 5 p.m. on December 8th. In March, April, that's when awards will be announced. Projects will begin in May or June of 2026, and then they will end 12 months later in 2027 of May or June. This is the email where you can contact us or via phone. And as stated, this recorded session will be on our grants website, which we can click on here, and I will just show you what that looks like. So this is our page here. The recorded info session will be under here where it says upcoming funding opportunity. We will post a Zoom session here so you can watch it at your leisure. Okay, let me stop this share and I'm going to go back to the PowerPoint presentation. Okay. So you will create your accounts. And what documents are needed for this application? So documents that are needed is the application cover sheet. And like we said, we give you that template. So please just feel free to fill it out as is. You will have to submit a proposal narrative, and the full application has expectations for the proposal narratives and has the sections that we want covered on. The budget narrative, we do have that template. Please use that exact template that we have on there. I'm sorry, not the budget narrative. We have the project budget template on there, which is an Excel sheet. Now, the budget narrative is an explanation of a further explanation of your budget, and we want that on a separate document. So there's more information of the budget narrative in the full RFP, but essentially it's just documenting how you plan to spend your monies down, if there's any personnel costs, if there's any supplies, etc. Getting more into the nitty-gritty of the details of how that money is projected to be spent. We also ask for your 501c3 tax-exempt status document to be uploaded with your board of directors and the operating budgets. Now, support letters and memorandum of understanding, also known as an MOU, these are very, very important and critical to have, and they are required if you are partnering with another organization. So if you have any type of partnership, or if someone is acting as your fiduciary, or you plan on collaborating on anything, it's really important to have support letters and MOUs in there. So what you can also include, it's optional, is your annual financial statements, but everything in the yellow is required and the blue is optional. So again, that's your cover sheet, which we have a template for. The proposal narrative, which is the project intervention itself. It's you explaining what exactly is this project doing. That includes your evaluation, your sustainability, staff, who do you have on staff, and the project intervention itself. The budget narrative is just a more in-depth and detail of how you plan to spend those funds down in a Word document or a PDF, like a detailed itemized budget. The project budget is an Excel sheet, and we have that template for you to use, so to fill that out. And then the remaining are the remaining three, which are your tax-exempt status, board of director, and operating budget. Those are things that are related to your organization itself. And support letters, or the MOU, memorandum of understanding, that is just a one-page letter, explaining the partnership that is going to be had and the agreement between both entities. So as always, before you submit, just make sure you have all of the required documents uploaded before hitting submit. So what does the timeline look like? So our RFP is now open. It closes December 8th at 5 p.m. It'll then be reviewed by our Community Health Coordinating Committee. And so you get to see the reviewer bios on there. It was one of the last documents. So you can see exactly who is going to be reviewing these proposals and their affiliations. And we also have some expert and community members as well who will be reviewing them. Awards will be notified by February of 2026, and then projects are expected to begin spring of 2026. So if you have any questions, again, this is our website. Actually, you can use our updated one, which is shorter and easier to remember, which is bit.ly/CHPI rocks. I put it down in the chat below as well. And it's also in InfoReady. So you can click directly on it when you are on InfoReady. So our website contains information such as our CHNA and implementation strategy. It also has information about our review committee, which is our Community Health and Coordinating Committee. It also has information just about previous projects that we have funded in the past. And then it will also include this informational session recording. So now, without further ado, if you have any other questions at any other time, you can feel free to email us at mm-chsgrant@med.umich.edu, or you may call these numbers on the screen here, which is 734-998-0297 or 734-998-2156. So now, if there's any questions in the chat, there's no questions so far in the chat.
Barbara from SOS wants to know, what data do you require from grant recipients with respect to data sharing?
Yes. So data will vary from project to project. However, in the evaluation, we do expect data to be collected. So those are things such as quality and or quantity. So they can be things such as survey feedback. It can be metrics in regards to health outcomes. It can be data in regards to basic geographic information like zip codes of your patients, or what health systems do they typically use. It can also be income levels. So it really just depends on the project itself and what data makes sense for your specific project. However, can everyone hear? Yes. However, it really just depends. In terms of data sharing, we never ask for identifiable data. Most of the time it'll be de-identified. We ask for higher over level data, such as percentages, things of that nature. In the rare case, we may want to cross-reference to see if someone is a patient of ours to do services, but we will actually talk more about that. If your grant gets funded, we have a pre-award meeting, and in that pre-award meeting, we talk further in depth about evaluation, data, and metrics, and we also provide some suggestions as to what we think should be tracked based on your specific project. Do you want to add anything, Karen?
No, that you wrapped it all up. Okay, we have Anna Harwell from Telling It. She has asked, they operate under U of M as the fiduciary, but they are not a 501c3. They are asking if they are eligible.
Okay. So unfortunately, you do have to be a 501c3 in order to, or have a 501c3 on the grant in order to qualify. So if you're a grassroots or anything of that nature, the stipulation is you must partner with a 501c3 located in Washtenaw County in order to be eligible. Now, since U of M, you said U of M is a fiduciary.
Yes, but I think in this specific case, for this specific opportunity, you are not eligible because of U of M being the fiduciary, but we can double check on that.
Okay.
One
contact page back up.
Yes. Barbara from SOS is asking, can we provide some other examples of projects and innovations that have occurred through our grants program?
Yes. So on our, I will stop the share and I'm going to go to our website and then we will just discuss from there. So this is our website right here. And on the bottom, if you just scroll all the way down, it says past and current grantees. So these are all of our current grantees here. The links will take you to their direct website. If you want to learn more about the specifics of all the grantees, feel free to email me and I'm always happy to talk about them. One cool thing we're doing this year as well is I'm creating one-pagers. So those one-pagers will actually be posted on our website here. So you can learn about what every single one of our grantees are doing. So more information to come on those. But I'm just going to give just two specific examples for the purposes of this. So Corner Health Center. Corner Health Center they're one of our grantees who finished up their grant, and they had a doula program. And so what they did is they had doula services available for those in need. And so doula services encompasses wraparound services, so they can do things such as, breastfeeding education, car safety education. They do things as just helping the mother mentally, and they can also just help take off the home responsibilities. Just simple things as letting the mother rest, right? Like going in, cleaning dishes, going in, letting the mother take a nap, rest and recover. And they've also talk with the family in depth about social services that are available to them, as well as coping mechanisms. So that's one of the grantees that we had at Corner Health. Another one that we have is Women's Center of Southeastern Michigan. And so we provided funding for them, and they have provided mental health services to those who are uninsured, primarily, and they focus mainly on the Latinx population. So they hired a bilingual therapist. So she's Spanish speaking, and they also hosted support groups. And so people could sign up, join these sessions, and it was a great resource to those whose first language isn't English. So it's hard to find bilingual therapists here in Washtenaw County. So that was another one of our grants. Can I go over one more? Another grant, an internal grant I will talk about. Just to clarify, for this round of funding, this is only open to 501c3 nonprofit organizations, but in the past, we have opened it up to internal departments. And so one of our internal grantees was U of M Health, Michigan Medicine, Ypsilanti Health Center, and they actually had a partnership with MAP, which is the Michigan Advocacy Program, and they provide free legal services to their patients at the health clinic. Most of their caseload is surrounding housing and education. So they've made great strides in talking with landlords and dealing with things that have gone by the wayside or that are not up to code in terms of building regulations, as well as getting students the support they need in the classrooms.
Brody Jason has a question wanting to know if the funding allows for indirect costs. If so, what is the percentage or amount?
Yes, that is a great question. So we do allow for indirect cost. Currently there is no stipulation as to how much of that goes towards indirect costs. What we do say is we always want the majority of the money to be driven towards community members. Right, your budget needs to make sense and be financially sound. So we want most of the dollars to be driven towards community. However, we do understand that in order to do the work, people power is needed, but we don't have a certain threshold or anything. It's just, every project is different. The amount of support is different. So it's hard to put a number on it. It just doesn't make sense.
I will say this though, indirects that are above 30% are not going to be looked favorably on in terms of funding. So it should be below that.
Other questions in the chat?
There is a question, but I'm going to follow up on it because there is an organization that the fiduciary is a school district, and they wanted to know if they were eligible. And I told Marky Long that we'll have to follow up because we have not encountered that before. And then Leslie is asking how many grants will be awarded.
So currently we are aiming for possibly 6 grants. However, it really all just depends. We don't want to say a specific number just yet, because we want to see how many applications we receive, and based on those applications, people might select for a 75,000, or they might select for lower than 75,000. Maybe we have two proposals that select for $50,000. That means we could possibly fund one additional project with the remaining $50,000 from those 2 projects. So right now we're aiming for about 6. However, that is to be determined based on the number of applications we receive, and the quality of applications we receive as well. So just because we say we have 6 doesn't mean that all 6 are going to be funded. Again, we really want these projects to make sense for the community, and to, you know, really have show impact or show a promising impact.
Okay, Marley is saying, is there any impact on the application if an organization or a partnering organization has previously received a grant through you? Do you want me to say?
Yeah.
Okay, so yes, we do consider if you have received a grant from us before and the type of grant. So for instance, if you were a project that at any point during the past 8 years has received an evidence-informed project funding type, that may potentially affect if you are to be funded at all. As Lupe had stated, anybody who is not currently eligible to apply is funding, but or anybody who is currently not funded by us is eligible to apply. But like I said, if you've been funded once or twice, and depending on the level, that could apply. So if anybody has a specific question for their organization, I encourage you to reach out to us and we can give you better guidance then, because we would deal with this on a case-by-case basis. And part of this is because we want all different organizations to be able to be supported and carry out the good work that they're doing in the community without providing favorites to any specific ones. And we also want to build support for grassroots and smaller nonprofits in this space.
I also just want to add really quickly, when you go on Info and you download the full application, at the bottom here, we also do have an FAQ section, and sometimes that gets missed, but sometimes some of the questions you have may already be here, such as if you're not located in Washtenaw County, can you still apply, etc. So we do have an FAQ section that is on our full proposal. So that is, again, something that is on our Info Ready website that you can download, and you can just see, you know, what the requirements are, basically everything that I stated, but just more in detailed length, like our requirements, our timeline, what is being judged, right? So we have, we're essentially giving you the full template of what we're looking for, right? And the scoring for each section here. So as long as you follow this and answer each one of these things, your proposal should be ranked highly, in theory.
Okay, I just want to, there was a comment asked about if agencies are located outside of Washtenaw County, are they eligible to apply if they are partnered with a qualifying 501c3 entity, correct? I replied in the chat that if they are outside and they're partnering and or they work directly with Washtenaw County residents, they are allowed. And I gave the for instance that MSU Extension and MOASH were two organizations that main offices are outside of Washtenaw County, but they have an office or they have worked with Washtenaw County residents directly. And so they were able to show that, and therefore could be funded.
And that's also in our FAQ section here, which is questions 3 and 4. Any other questions? And again, if you have any other questions, at any other time, feel free to email us or call us, because sometimes, these things are, as Karen stated, case by case specific, and we'll be able to give you more detail. You tell us a little bit more about the lines of, what you're thinking in terms of your project, or if you've been funded with us in the past, etc. Is there a question?
No, just someone thanking us for the helpful and thoughtful answers.
Yes. And then also I encourage, if you find that, if you're here joining us today and you find that, after hearing us, you're not eligible, I would strongly suggest that if you know someone that is eligible, feel free to share this as well, to others that you think, or other organizations that you think may be eligible. We understand that right now is a very interesting time, where funding is very limited, and we really do want to drive these dollars out into the community, to help where we can and fill those gaps. And we'll also be sharing this opportunity on our social media starting next week. So if you can help spread the word on our social media, share that or share the link. Again, I will insert the bit.ly link I will insert the bit.ly link here for the direct application, but it's bit.ly/CHS 2025 RFP. So that'll take you directly to our opportunity. So I just entered that in the chat right now.
So I guess if there's no other questions, just feel free. If you do have any questions, if you have any challenges with any of the templates or if uploading, we are all here in addition to our director to help support you in this endeavor. If you have questions about your project or your scope, we can help with some direction. We can't necessarily plan it out, but we are here to help you with anything that you need. So just please be in touch. We love questions, and just thank you all for being here today.
Thank you all, and this session will be posted on our website, which is bit.ly/CHPI rocks, and then I also put it in the chat within a week or so. So you can go back and watch it if you would like. But yeah, thank you all for joining us today. Bye.
Thank you.
Thank you.